Okay, this video is biggest nutrition misconceptions of 2025. Biggest nutrition misconceptions of 2025. Okay, first of all, there's no good fats. This whole slogan of good fats, that's just a way to trick you, okay? What people do is they come up with a good slogan that sounds nice. And then everybody feels, oh, they're obligated to obey that. Oh, of course, some fats are good. I don't want to be extremist and say all fats are bad. No, I'm going to tell you, all fats are bad. Nathan Pritikin said that a long time ago, back in the 1980s. He reviewed all the literature on fat. All dietary fat is bad, other than the little bit that's present in low-fat plant foods. Dr. John McDougall, the greatest doctor who ever lived, he said that the biggest toxin in the Western diet is the excessive amount of fat. Walter Kempner, considered the second greatest doctor who ever lived, he fed his patients a very, very low-fat diet. It's in the ballpark of around 3-4%, something like that. So you really want to minimize dietary fat. All fats, all of them, every type increases the risk of being fat. The lower the percentage of calories from fat, the skinnier you'll be. So all fats increase the likelihood you're going to be fat. They all increase your risk of being diabetic. They all increase your risk of atherosclerosis. David Blankenhorn study. It didn't matter what type of fat you fed them. They all caused increased atherosclerosis risk. Omega-3s, so-called, sacred omega-3s, they increase your risk of atrial fibrillation. And of course, obesity, diabetes, atherosclerosis, as I just said, they suppress your immune system. They increase the risk of metastatic disease in animals. How could something like that be good for you? Okay, it doesn't make sense, all right? And fish is totally stupid, okay? The ocean is a sewer. It's full of mercury. It's full of other toxins. Fish is the most acidic food. It's real high in sat fat as well. It's a loser. Animal protein's bad. Okay, omega-3 is also associated with increased metastases in animals. All right, what's next? Omega-6. Omega-6 is for chumps. Tetsumori Yamashima, Japanese MD, PhD. He showed, he's got the whole lipid peroxidation, toxic aldehyde, hydroxynonenal, calpain-cathepsin theory of, cell destruction for neurodegeneration. It also increases the risk of diabetes. It causes death of pancreatic beta cells that make insulin. Omega-6 are for losers. They stink, all right? I've gone through much more detail on all these subjects in my other lectures. This is just a quick summary, okay? Let's see. Low-fat vegan foods contain all the essential omega-3s you need. There's only two types of essential fats, the C18, 18-carbon version of the omega-3 and omega-6 fats. Linolenic acid, alpha-linoleic acid. Okay, so that's all you need. And then from your fiber, you make short-chain fatty acids in the gut bacteria. That's all you need for fat. That's more than enough fat. You'd be perfectly fine with that. That's been well shown a long time ago. All right, it's impossible to be too low in protein. Everybody's worried about protein, but people are way overeating protein. Breast milk only has 6% of calories from protein at our most rapid phase of growth. We need less the rest of our life. The Golden Study took a bunch of starving people, fed them 2.5% of calories from protein, and they did very well. They don't need any more protein than that. High protein diets are associated with decreased longevity. If you take animals, you can calorie restrict them, and they all live longer. Then they found out you can just protein restrict them, and they all live longer. You can even methionine restrict them. That's just one essential amino acid, and they'll live longer. So, you want to live longer, it sounds like protein restriction is the way to go. James Mitchell, PhD, Harvard guy, he is a good lecturer at Buchinger Wilhelmine Clinic. He also emphasized that low-protein diets look like the best thing to maintain long-term good health. High-protein diets are associated with decreased longevity. They raise your blood cholesterol level. T. Colin Campbell wrote a lot about that. They sort of induce an anabolic growth phase that raises blood cholesterol and is atherogenic. They also increase your risk of kidney failure. The main job of the kidney is to excrete nitrogen. There's no nitrogen in fats and lipids, so the more protein you eat, the more workload you're throwing on your kidneys. And the worst is animal protein because it's also highly acidic and it's also strongly associated with AGEs, advanced glycation end products, and all the saturated fat causing insulin resistance and diabetes. It's all bad. You're not going to win with that. Low protein diets, like I said, have been shown very good by Walter Kempner, was feeding people incredibly low amounts of protein. I think it was around 3 to 4%. Papua New Guinea, they'd eat 93% of their calories from sweet potatoes, which has 4.5% of calories from protein. And that was more than enough. They're fit, strong guys, do a lot of manual labor. They've also shown chronic kidney disease patients, which is tons of people over 60. They do much better with low-protein diets, even very low-protein diets. Very low-protein diet might require some additional essential amino acids or essential amino acid analogs, but the point is low protein is good. Okay, it's impossible to be too low in calcium. That's been figured out a long time ago. And the funny one is these Bantu women. These are black women in South Africa. They typically have like 10 babies because when you don't have birth control, women tend to have about 10 babies. So I always laugh, a woman trying to figure out, what's her purpose in life. ever since the beginning of time, women have had a lot of babies, okay? Up until birth control was widely available in the 1900s, women would typically have like 10 babies, 10 pregnancies, that led to a baby being delivered. Modern women, what are they having? 1.5. And they wonder why they're lonely and unhappy. Okay, so anyways, the point was the Bantu women were having 10 babies, nursing them for 3 years. They have very low calcium in their diet. They don't have any problem with osteoporosis. Who gets osteoporosis? Little old white ladies who drink milk. Because animal protein is acidic, and the acidity needs to be buffered. The kidneys excrete the hydrogen protons, the acid, and that's coupled with excreting calcium. So they excrete calcium into the urine. And some of that calcium also comes from the muscle, but you're basically peeing your bones in the toilet. You're also causing muscle wasting. So they're physically weak and they got soft bones. It's a bad combination. So milk actually increases your risk of osteoporosis. The dairy industry doesn't want you to know that, but that's been shown. And then the other thing that's funny is calcium supplement is not the way to prevent osteoporosis. It's stupid. Women who do that, they take over 1,400 milligrams per day. They have a 2.6 times increased death from cardiovascular mortality. I think when you get a transient bolus raising your blood calcium level transiently, it has a prothrombotic effect. Calcium is a clotting factor, okay? So what is atherosclerosis? A blood clot. What is a heart attack? A myocardial infarction. It's a blood clot in your artery of your heart. So why would you take a bolus of something that's going to make you hypercoagulable, potentially make you die? Not smart. Most people are too high in iron. The exception is some menstruating women. But most people, Americans, men after 20 years of age, when they stop growing, women after they stop menstruating, they're iron overloaded. So you don't want extra iron, unless you're a special case where you've got iron deficiency anemia. Again, most commonly in a menstruating woman. Social logic does not work for nutrition. Most people, their default setting on how they think about most things is social. Okay, and that's good for social stuff. When in Rome, do as the Romans do, everything in moderation. But the problem is, it's not like that for diet. You don't want to be like the average person. The average American by 55 to 60 years of age, they're fat, sick, and stupid. They're still, they know how to find their way home, but they've lost their capacity for intellectual nuance. They've lost their energy, their vitality. They've lost their looks, okay? I had to run around and do some errands today. It was almost like every single woman I saw, except for one, they were all fat. And, that's non-negotiable. If a woman's fat, she's not attractive. I'm sorry. It's just, we can't help it as men. We're not attracted to a fat woman because in nature, that means she's pregnant or she's a grandmother, okay? And that's not attractive. It just isn't. So, you can't change the way things are. Because we see that hourglass shape. It's dangerous to approach a woman unless we have a chance to make a baby with her biologically, evolutionarily. Our mind says, no, don't approach that for romantic reasons. Okay, so what else about diet? Anybody that sort of eats a westernized diet, the vast majority of them are fat and sick. The older they get, the more fragile they get, the less physiological reserve they have to compensate. I would say the SAD diet, standard American diet's like 90% stupid. There's very little good food in there. Paleo keto carnivore is about 70% stupid. Unless you got refractory epilepsy, it's not a smart move to go down that path. You can transiently have some weight loss or improvement over a course of 3 to 6 months with any diet because of the Hawthorne effect, because you're paying a lot of attention to it. But long term, it's not sustainable. You're going to be constipated, at risk for heart disease, stroke, a whole bunch of other problems, kidney stones, diabetes, hypertension. Okay, Mediterranean diet's about 50% stupid. It was much more of a vegan diet back in the day when Ansel Keys described it. Nowadays, people use it as an excuse to eat oils and other high-fat foods. Nuts, seeds, meat, chicken, etc., olive oil, all that stuff is bad for you. The other thing that's become more popular these days is the vegan version of the Mediterranean diet, which is sort of moderate to high in fat. I call it the high-fat phony diet because it pretends to be the replacement for the Dr. McDougall diet, the starch-based vegan diet, but it's not. It's a moderate to high-fat diet, and I think it's a mistake to eat that way. And I know a lot of people become sellouts, because that's where the money is. You can sell omega-3 supplements, you can sell nuts, you can sell seeds, you can sell a lot of other stuff. Nuts also, not only are they high in fat, about 80 to 90% fat, they're also high in advanced glycation end products. I would not eat them. But that's where the money is, and people start to go down that path and they sell out. For a lot of them, they do this for a living, so they have to make money somehow off this nutrition stuff. I just do it as a hobby, so I don't need to make money off it. I don't have to BS you. Also, I'm Christian, so I got my Christian ethics, and I want to be one of the great doctors, so I'm not going to sell out and just try to make an extra $50 lying and trying to promote some BS. Okay, what else? Too high in fat, too high in protein, too high in advanced glycation end products, and they allow some caffeine and oils. You don't want any of that stuff. Okay, so what's the best diet? The best diet is low fat, because fat is bad, remember that. vegan, you need a little bit of fat, but all the fat you need, you get it from low-fat plant-based diet. By the way, I'm 61 years old. I have no medical problems. Okay, my energy level's great. My academic concentration ability, it's all great. So that's what you want. I don't take any pills. I don't go to doctors. I don't go for all this BS like calcium CT screening study. That's for stupid chumps. You already know if you ate the standard American diet earlier in your life, you've got atherosclerosis. So instead of going for more tests or getting a tube stuck up your butt, why don't you just eat healthy? Start treating the problem, preventing the problem. The best prevention treatment for almost all the chronic diseases is eat the low-fat vegan diet with no oil, okay? And when I say that, I also say ideally you want to be 100% organic, so they're not spraying so much crap on your food like GP and atrazine. Should be whole foods, real foods. They should all have only one ingredient. If there's a second ingredient, they can put other things into it. You know, MSG, MFG, other things too. Low sodium is better. Low protein is better, as we just spoke about. You're going to probably end up somewhere around 80-10-10, which means 80% carbohydrates, 10% fat, 10% protein, or even more carbohydrates, 85%, you know, and then 7.5 or something on the other two. No caffeine. Caffeine's bad for you. Coffee's bad for you. Tea is bad for you. All that stuff you heard about being good for you is BS. Just so you know. I'm giving longer lectures on every single thing I talk about here, but I'm giving you the quick scoop if you want to hear it. All alcohol is bad. All that stuff about 1 or 2 drinks a day being cardioprotective, that's all BS. Alcohol is bad for you. It's a poison. It's poison to your brain. It's poison to your arteries. It's poison to your liver. It's bad. Tobacco, are you an idiot? Don't smoke, okay? MJ, some people think, oh, MJ's good. A lot of people who think MJ's good are like think that they're clever or something. You're stupid. You're a loser, okay? You shouldn't touch MJ. It's a poison. It's a brain poison, too. It can cause schizophrenic breakdowns. I've seen a bunch of those, and they're not good, okay? I'm a brain doctor, and I have a lot of friends who are neurologists. MJ is bad news, much worse than people think. It's also feminizing. It's estrogenic. Okay, and again, why eat any of these diets that aren't 100% good? Eat the diet that's only good. Only put good food in your body. Avoid the bad stuff. The older you get, the more fragile. And if you don't take good care of yourself, your health habits have to improve. You end up having problems, okay? Okay, you want to also, you know, manage your stress, you know, whatever's involved in that for you. Adequate sleep. You want to exercise, at least walk every day. Go upstairs. Just rearrange your day routine to make sure you're getting more stairs and more exercise. Maintain your social support. Try to get along with people. Have a sense of purpose. If you're pushing yourself to do something good with your life, that gives you more resilience to endure all the inevitable problems that you're going to have. Also, religious people, they're much healthier. If you take demographically matched religious people, they're way healthier than other people. It gives them a sense of peace, a sense of purpose, a sense of meaning. They sort of let some of their stress go over to God, accept their fate in that sense, and they're just a lot healthier. Harold Koning's written quite a lot about that. And watch out for stupid things like everything in moderation, you know. That's stupid. Why would you put moderate amounts of good and bad food on your plate? No, put all good on your plate. Caldwell Esselstyn, the doctor who has the best results in the world for treatment of coronary artery disease and prevention of coronary artery disease, he says moderation kills. And I see the same thing. If you half-ass the diet, you'll just get not even half the benefit. You want to make it as good as you can make it. Yeah, one day on the weekend you might break down a little bit. Okay, but just then get back on the wagon the next day. You do as well as you can. Anyways, these are the secrets of being healthy, and there is no medical, surgical, bullshitology technology that can change this. You can't treat effectively a dietary disease with a pill. You can treat it, but they don't make that much difference, okay? If you want to cure any of these diseases, prevent them from progressing, there's the answer. So instead of, whining and bitching, what you should say is, thank you, God. It's not inevitable I have to be fat, sick, and stupid like everybody else. Thank you, God. I'll do it.